use they, them pronouns, and I am currently based in Olympia, Washington. I was 22 years old when I had my abortion, and I was at the time in rural Idaho going to college. The decision was really easy for me. I knew that I did not want children and that I had chronic illnesses that prevented me from having children, so as soon as I found out that I was pregnant, I immediately made an appointment at Planned Parenthood for an abortion. As soon as I made the appointment, I had just missed my first period, but as we know, technically you're considered 4 weeks pregnant by the time that you miss your period. So I made the soonest appointment that I could at Planned Parenthood, and that was already a month out. So at this point, I was gonna have to wait like 8 to 10 weeks before I was able to get the actual appointment. And in Idaho, there were only 3 clinics at the time that performed abortions, and the closest one was over 45 minutes away from the small town that I went to college. So not only did I have to find time off of school to be able to get there and take time off, but also find a way to get to the other side of the city. I didn't really have any support at the time. I was living in the dorms. It was the middle of like the height of the pandemic, and so I had a room all to myself. I didn't have any roommates, wasn't really in contact with my family, and I had to figure out how to navigate the situation without any support systems. If I had been in another state, there would have been less barriers. The limited amount of clinics within the state made it so that appointments take much longer to be able to get and be able to be seen, as well as having to find a way to get to the location. As well as in Idaho, there were specific laws in place when I got my abortion that were intended to discourage people. So there was the 24-hour waiting period, as well as a mandatory ultrasound where they try and honestly talk you out of it, ask if you want a photo of the ultrasound, really invasive and uncomfortable questions. What I want people to remember is that while I received this care in December of 2020, now in Idaho, the same procedure would be illegal. And not only is there a total ban on abortion in Idaho, but there's also penalties for providers. So the care that I received that was essential for my health and well-being, that was my life-saving care, I would not be able to receive today. And the doctors that provided that care, that supported me, that empowered me, now are not able to do those procedures even when it's necessary, and they can even face criminal penalties for doing so. So I think it's really important for people to remember how significant the abortion bans going into effect are now, especially in red states, and how important it is to be able to protect people in states like Idaho. I decided to start sharing my story because when I found out that I was pregnant and that I wanted to get an abortion, I didn't know anyone else in my life that I knew had received one. So it felt scary to me, it felt isolating, and there was a really big stigma around it that when I told people, it was like a hush-hush thing. People started to whisper, they didn't want to talk about it. One of my family members found out and they kept it a secret from the rest of my family. So after I received my abortion and I started to tell like a friend or two about it, I realized that there were multiple other people in my life that had similar experiences, but that had never shared it. And so knowing that there was actually a really big community, I think helped to really combat the stigma, helped me feel supported, helped me feel like it was a normal, healthy decision, and it really validated the experience that I had and the decision that I made to empower myself. Being able to have the abortion, for me, that means that I was able to finish school. So I was a senior in college, it was the fall, it was finals week, and I was able to actually finish my classes, take my exams, and graduate that year. And then I attended a master's program. So if I were not able to have the abortion, I would not have been able to start my graduate program, I would not be a student today in a master's program, and I wouldn't have been able to continue my education. What I want people to know about people who receive abortion care is that for many people, it's a life-saving decision. It's one that validates their identity, their experience, their autonomy over their body, and it's also really important and empowering to be able to let people make that decision for themselves, to know what their goals are, how having children or not having children fits into that plan, how their health is in their body, and whether or not they're able to support a pregnancy or whether that's the right decision. Yeah.